thank everyone for being here today. It's certainly our honor and privilege for Owensboro Health to host Senator McConnell. He's certainly been a friend of all Kentuckians, but especially Western Kentucky and this institution. As you know, he's been here many times before, and we always are pleased to have him come back. He was here earlier this past year when we were talking about the vaccines and we were talking about the damage that COVID-19 has had on our institution and what we were hoping to see come forward. We've done a lot of work over this period of time, and you know, we could talk days about how much work has been done, not just here but in every institution, every hospital, from the standpoint of just protecting the public, getting the vaccines, taking care of our team members, but also our collaborations with other agencies in our region. We've just come out of a meeting with Judge Mattingly and Mayor Watson, with Clay Horton, our health department director, our pharmacist that really led the way for us to have a vaccine clinic. It's been extremely successful. But today we're talking with Senator McConnell about his information about how well the vaccine is working, what have we learned, and he has been a big friend of us in terms of CARES Act. He was instrumental in authoring that and certainly pushing that through. That without that, most people would not have done very well in healthcare. But we're grateful for him, and he's done many other things that he can share with you. Some bills that are coming up and some things like that I'm sure he'll want to discuss. But we have Dr. Dufresne here, who actually, from our perspective, our CMO of the system, who led the charge in terms of managing the vaccine clinic and communicating with the mayor and the judge of the health department on daily almost about how we were doing and what we needed to do better, and kind of explaining to the public, answering their questions as well. So we've had a great outcome of this situation. We're down to very few patients in the hospital that have COVID positive, and we are looking forward to the day that we get to get big goose egg and nobody's here being sick with COVID, and everybody can get back to life as we know it. I look forward to that, and I'm sure you and the people that you represent do as well. So, Senator McConnell, I welcome you again and allow you to speak in behalf of all the great things you're going to do for us. Thanks.
Thank you, Greg. It's great to be back at Owensboro Health. When I was last here, we didn't have a vaccine. You go back a year ago this month, we had sent everyone home all across America. In the Senate, beginning in my office, we were wrestling with what to do about two things that were intersecting. One was a 100-year pandemic, and the other was the advice we were given by public health professionals to literally shut the economy down and send everybody home. So we had both a healthcare emergency and an economic emergency simultaneously. Out of that grew, in spite of the fact that we were in the middle of a presidential election year, extraordinary bipartisan cooperation. There were 5 different bills passed, the largest of which was the CARES Act, that cleared the Congress with very little opposition. Several of them passed unanimously in the middle of a presidential campaign. So I was proud of the Congress' ability to respond to this extraordinary emergency that we were faced with. We tried to tackle it on every front, but clearly we knew at the beginning that the only way we would ever get past this was with an effective vaccine as rapidly as possible. And so a significant part of the bills that we passed last year were for what's called Operation Warp Speed, aptly named. We got to get there as rapidly as possible. I was a polio victim when I was a youngster, and I'm fully aware, as I grew up, how long it took, decades, literally decades, to develop a vaccine to end the polio epidemics that we would have periodically in our country and around the world. So I must tell you, honestly, I was a little skeptical as to how quickly we could get to a vaccine. It's a modern medical miracle that in late December, we started shipping the first vaccine, and now we have 3 vaccines, 2 of which are 90% effective or more, one of them 70% or more. And to put that in perspective, I didn't realize until this year that the flu vaccine is only 50% effective. So extraordinary effective rate being disseminated rapidly. And all of it, up until the last bill, right before the previous president left office, a $900 billion additional bill, done largely on a bipartisan basis. So where are we this year? When the new administration came in, 10 of my members, Republican members, the Senate went down to meet with President Biden to talk about what we thought we could do on a bipartisan basis consistent with where we are now, not where we were a year ago. And it involved roughly $500 billion, which is still an enormous amount of money. So let me just talk a minute about the national debt. After what we did last year, we now have a national debt of $27 trillion, which is the same size as our economy. That's only happened one other time in American history, and that was during World War II. So we already have an extraordinary amount of national debt. Clearly, last year, because of the 100-year pandemic, we could justify doing that. By the time we reached this year, we had 3 effective vaccines. We were moving in the direction of opening up the economy. And my view, and the view of almost all of my Republican colleagues, was the size of the bill should reflect where we were now, not where we were a year ago. And so this became a partisan exercise. And in the end, the $1.9 trillion bill the President signed a couple of weeks ago had no Republican support in the House or the Senate because we thought it was anchored in conditions a year ago rather than currently. To show you how much of that money was spent in a way that I think is unrelated to the current crisis, 1% of the $1.9 trillion is for vaccines. 9% of the $1.9 trillion is for health care, what they do here at Owensboro Health. The rest of it, arguably, is unrelated to the condition we find ourselves in now. And so we're in a different place in terms of a totally bipartisan view of what we need to do to finish the job. Clearly, the job will be finished, as I just learned from folks in the room in our meeting, is we need to get to herd mentality. What's the word?
Herd immunity.
Herd immunity. Roughly 75% of the population. And so I'm trying to encourage everybody to get the vaccination. I had seen a piece on television saying that Republican men were somehow reluctant to get the vaccination. As a Republican man, I wasn't reluctant to get it when I was eligible, and I would encourage everybody to do that. And there may be some segments of our population that still have some reservations about this for one reason or another. But what I heard from these healthcare professionals behind me is there's no real good reason not to get the vaccination. And the sooner we can get to 75%, the herd immunity and get our economy up and open, the better. In the meantime, I think the advice of everyone is let's continue to social distance and wear a mask as we move toward, hopefully, by sometime early summer, being able to put this whole experience in the rearview mirror. With that, I'll be happy to throw it open to see what you'd like to ask about.
Hi, my name is Katie Terzak. I'm with 14 News WFIE. I'm the local NBC affiliate here in town. So first, just had a few questions for you. One thing I wanted to ask is, Indiana, our neighboring state, will drop from a mask mandate to a mask advisory starting April 6th. So my question to you is, do you think Kentucky should still be under a mask mandate moving forward?
Well, I've not second-guessed the governor's decisions on those. I think every state has had slightly different view, so I wouldn't give the governor of Indiana any advice either. And as far as the governor of Kentucky is concerned, I generally supported his decision on that.
Okay. And then do you think Kentuckians and Americans should get a fourth round of COVID relief money?
Well, I just said that I thought about 1/4 of what was recently done would have been appropriate for where we are now. And I am alarmed about the size of the debt. It's one thing to go into debt when you've got a 100-year pandemic. But you saw the president just yesterday in Pittsburgh recommending we're going to do it again. With a combination of massive tax increases on businesses and individuals and more borrowing to add even more to the $2 trillion national debt. I think that's a big mistake. And I think that package that they're putting together now, as much as we would like to address infrastructure, is not going to get support from our side, because I think the last thing the economy needs right now is a big whopping tax increase on all the productive sectors of our economy. Remember, February of 2020, just a little over a year ago, we had the best economy in 50 years. The principal reason for that was the tax reform package we did in 2017, which drove the rates down for corporations, for individuals, and for those who were producing the jobs that were benefiting everybody in the country.
Okay, and then what about Owensboro Vaccines? You know, obviously, local news, we've been working hand in hand with Owensboro Health many, many times. So what do you have to say about their rollout? How do you think that their vaccine rollout here locally has been doing?
Well, I've been impressed, so why don't we hear from the expert here?
Thank you, Senator McConnell. So our vaccine program here started on December 24th. We got the vaccines tonight at December 23rd, so December 24th we started. Our vaccine rollout has gone incredibly well. We have a real team effort with that. By the end of today, we'll be giving out about 67,000 vaccines, first and second doses. A good portion of our community in our hospital are already vaccinated, and we now have vaccines open up to everyone. So it's been a tremendous effort, a tremendous team effort.
Perfect. Okay, and then one more question for Senator McConnell. All right, so can you elaborate on the presidential disaster declaration for Kentucky due to the ice storms and flooding?
Yeah, I believe just today the president did declare the declaration for the ice storms that we had earlier this year. I believe the assessment is still underway on the flooding. In fact, I was in Eastern Kentucky Monday meeting with the county judges in the key counties that really got hammered, Lee County, for example. And that assessment is underway, and all of the delegation will support it. And as soon as the assessment is completed by FEMA, I expect the governor to make his decision, and that will be backed up by the president.
Okay, and I lied, one more thing. You guys, I don't know if this is an Owensboro Health question or for you, what about more vaccine locations popping up? I know that we have been aggressive, but can we see more Walgreens? Can we see CVS, more Kroger vaccine locations in the next couple weeks or months to come?
I believe so. So we have several vaccine sites here. We do it here at the hospital. We do it at the health park. We also we have a vaccine site down in Muhlenberg County and Grayson County. So we really opened up the hospital portion of the vaccine clinics. We do know that for the health district, we've been working with Clay Morgan very closely, and they also rolled out a number of vaccine sites in the community. And then lastly, yes, I do think that you'll probably see more and more, walk-in Walgreens or Walmart and get your vaccine. So yes, I think it's probably coming.
Hey, doctor, are you concerned about a surge in cases here, since like we've seen nationally?
So we have a slight increase here. And if you look on the national map, Kentucky's not in that group of states that have 10 to 13% surge recently. So far what we're doing, we are really recommending that you do the things we've been recommending for the last year. You wear your mask, you social distance, with hand hygiene, has really helped to keep all that down, and we're going to continue to push for that. We've got a slight increase here, but nowhere near what you're seeing nationally, and I think it's because we're really trying to follow the CDC and the governor's mandates about all the proper things that we should be doing.
And Senator McConnell, do you have an alternative to Biden's infrastructure plan? Do you have an alternative to Biden's infrastructure plan?
Yeah, just last year, when my party was still in the majority in the Senate, we had a bipartisan infrastructure package. It didn't involve massive amounts of debt and wouldn't seek to tackle every single infrastructure problem in the country. But you're either alarmed about the level of national debt and the future impact of that on our children and our grandchildren, or you aren't. So my view about infrastructure is we ought to build that which we can afford, and not either whack the economy with major tax increases or run up the national debt even more. This whole debate underscores, I think, the principal difference between the two parties. This new administration, and its very, very narrow majority in the House, and its 50-50 Senate, nevertheless, is bold and audacious. It involves principally two things: higher taxes and more debt.
And what do you think of the new administration? How do you think he's doing? I know President Biden had a lot of ambitious goals coming in, especially for his first 100 days.
Well, I like him personally. I mean, we've been friends for a long time. He's a first-rate person. Nevertheless, this is a bold, left-wing administration. I don't think they have a mandate to do what they're doing. Admittedly, the president was not reelected, the previous president, but if you look at the results in Congress, a 50-50 Senate, and maybe a 3-vote majority in the House, I don't think the American people gave them a mandate to drive our country all the way to the political left. But they're not deterred by that, and they're going to try to do it anyway. And I'm going to fight it every step of the way, because I think this is the wrong prescription for America. Anyone?
The legislative session just ended in Frankfurt. What big changes can Kentuckians expect?
About what happened in Frankfurt?
Yes.
Oh, well, I'm an observer like you, and clearly what was going on was a power struggle between a Republican legislature and a Democratic governor. That's not uncommon. It happens as a result of elections, and I think looking at it from the outside, like all of you, the legislature, I think, is trying to claw back some of the executive power, which is not surprising. Not surprising the governor vetoes most of that, and I guess we'll ultimately see what the Kentucky courts will allow in terms of the balance of power struggle between the governor and the legislature. Other than that, I'm not an expert on the details of what they were doing.
We have time for one more.
Do you have an agenda for the year? Things that you're working on? I'm sorry, sir. I was asking, do you have an agenda, things that you're working on? We've talked about the president and his infrastructure.
Yeah.
What are you working on?
Well, the problem is I don't get to set the agenda anymore.
Well, no. You can sponsor bills like everyone else.
Yeah, well, but for one more seat in Georgia, I would be setting the agenda instead of Schumer. And So I'm now the defensive coordinator. I've been both. The offensive coordinator is a better job. You have a better chance to put points on the board. I said during last year's election, if I was still the majority leader and Joe Biden won, I'd make sure he was a moderator. So I'm not in a position to do that. So we're in a reactive mode. I'd love to find some things we can agree on. But look, as long as their agenda is, let's take a look at this transportation bill that the president laid out yesterday. Just to give you an example. There's more money in that plan that the president laid out in Pittsburgh for electric cars than for roads and bridges. Let me say that again. More money for electric cars than roads and bridges. We have some big philosophical differences, and that's going to make it more and more difficult for us to reach bipartisan agreements. We'll be able to do that, I guess, on smaller bills, but I think they're going in exactly the wrong direction, and that's not a great way to build a bipartisan coalition. Thanks a lot, everybody.
Thank you.
Thank you.